screening.
Going for a health screening by chance 2 years ago was how Daljit Kaur found out she had diabetes. That early detection was a lifesaver. The 79-year-old received advice on diet and lifestyle choices to prevent her condition from worsening. Her own experience also spurred her to become a diabetes nurse educator as a way of giving back to the community.
It's because I have been inflicted by it. I would wish to share my knowledge with everybody else so that the rest get saved, get managed earlier, get diagnosed earlier.
And that's also the hope of Diabetes Singapore. This year alone, it has already conducted over 2,000 health screenings. That's more than double last year's. Of these, around 10 to 15% were detected to be cases of diabetes, and even pre-diabetes, which is a warning sign of the condition.
What we do is we just don't leave them alone. So that's where we work before we go for any screening. We find out which are the nearest GP. So we basically want them to go and see a doctor ASAP.
The organisation says it's important that there's continuity in managing the condition, even after diagnosis.
There are also regular checks done on patients to ensure that any diabetes-related complications are detected in time. For example, vision loss is a common condition, so eye exams like this are done at least once a year, and it takes just around 15 minutes.
Private clinics are also seeing more people coming forward for checks as part of a national screening program. Some are seeing as much as a 30% increase compared to 5 years ago.
Early detection and screening is very important because diabetes comes with many complications that will jack up healthcare costs, especially for chronic diseases and complications like end-stage renal failure requiring hemodialysis for the long term.
And screening looks set to be key in Singapore's preventive care strategy, which will be rolled out next year. It will include more personalised care plans, which will benefit patients like Mr. Lam Kam Cheng, who's kept his diabetes under control with the help of his doctor.
I'm taking the diabetes medication every day, and then I'm trying to avoid sweet stuff as well in my diet. And I'm also following some of Dr. Vincent's advice on the dietary control, which is very helpful.